Good afternoon, everyone, and welcome to today's webinar on the topic of Health and Climate Nexus. This webinar today is part of the 28 for 28 series, where we are hosting as the United Nations in UAE a series of webinars to engage with the public on topics related to climate change, and especially ahead of the Climate Change Conference COP28, which will be hosted by the UAE later this year. My name is Sarah Shatila, and I will be your moderator for today's session. But before we begin, I also would like to remind you that we will be recording the session, and we will be sharing it on our YouTube channel as well. So you can also view all the previous recordings from the previous sessions, including as well this one, shortly after. We will share the link on the chat. We also want to remind you that if you have any questions, feel free please to share them on the chat as well, and we will make sure to include them in the discussion afterwards. So we all know that climate change is one of the biggest challenges that's facing our humanity today. But often what is less understood is the direct and indirect impact of climate change on human health, from the increased pollution, extreme weather events, spread of infectious diseases, malnutrition. The health consequences of climate change are severe and must be addressed, which is why in this session today, we will hear from leading UN experts who will cover the implications for human health in light of the climate crisis and examine policies and interventions to improve the health outcomes and adaptation measures. So we hope that this session will provide you with valuable insights, and we do invite you to engage with our speakers and post your questions directly in the chat so we can also highlight all the different elements that will be shared. Without further ado, allow me to introduce you to our guest speakers for today. Please join me in welcoming Mr. Mazen Malkawi, who is the Regional Advisor for the Climate Change and Health at the World Health Organization, WHO. We also have Ms. Mollie, who is the Sexual and Reproductive Health Program Specialist at the UN Population Fund, UNFPA. We also have Mr. Hossein, who is the Head of Secretariat at the UN Emergency Management Group, EMG. And last but not least, we have Deena Mariyam, who is the Health Working Group at YOUNGO, which is the official children and youth constituency at the United Nations Framework Convention on Climate Change, or UNFPA. So we will begin with a technical presentation shared by our guest speaker, Mr. Mazen from the World Health Organization, to tell us more about the current status of climate change and health in the Eastern Mediterranean region. Mazen, the floor is yours. Thank you.
Thanks a lot. Just give me a couple of seconds to manage the technology.
Sure.
I hope you can see my slides.
Great. Yes, we can. Thank you.
Thanks a lot. I'm Mazen Malkawi, Regional Advisor working at the WHO Eastern Mediterranean region. And as you may know, WHO is dividing the world into 6 regions. The Eastern Mediterranean region is one of those regions, and I'm saying this because some information from my presentation will be related to the region. So it's good to link the geography to the context. The Eastern Mediterranean region, 745 million people are living in the region in 22 countries, starting from Morocco in the west up to Afghanistan and Pakistan in the east. Although it's geographically one region, but it's quite diverse region from socio-economic considerations. One thing that I want you to keep remembering while talking about climate change, about impact of environmental risks on health, that in the region, unfortunately, we are losing 1 million people, and just repeat the number, 1 million people annually because of exposure to different environmental risk factors that are unfortunately exacerbated by climate change. As I said, the region is diverse. We have very rich countries, we have very poor countries in the region, but what is common actually between the 22 countries of the region is that we have a huge environmental risk touching and climate change impact touching in all the countries. That also, for a reason or another, we are the land of emergencies. 50% of the countries of the region are living in ongoing emergencies, which is affecting actually the development and the well-being. And also important to know that some of our countries share also the high risk in this. They are not ready to cope up with the emergencies and with risks. This diagram is a very famous diagram picked from the WHO framework on climate change and health, trying to summarize the relation between the climate change and health. And as you know, it's not a straightforward relation where the impact sometimes is not well estimated or identified. Climate change will affect the determinants of health. The air that we are breathing, the water that we are drinking, the food that we are eating, plus also it is increasing the frequency and severeness of extreme weather conditions. It will affect the vectors that are transmitting the disease, which all in all will affect the health system, and that's an extra pressure on the already exhausted health systems. And when COVID attacked us in the globe and in the region, that was a reminder that we need to be prepared. The health system need to be prepared. Otherwise, God forbid, it might be paralyzed because of things that we could have been prepared for. Some examples of the climate-sensitive health risks. You know, we have the injuries that are resulting from the severe weather conditions. You know, our region is a hot region. The heat-related illnesses, the respiratory illnesses caused by the increased air pollution, the waterborne and foodborne diseases, the zoonotic diseases. These are some of the examples of the health outcomes that are connecting climate change to health. And as I said, this will affect the health system as well as the healthcare facilities. This is a photo from a very dear country where we believe that the recent floods attacked that country were caused by climate change. You know, this is a photo of a hospital drawn by the floods, which is a very good example of how serious could be the impacts of climate change on health and on health infrastructure. As I said, we don't have exact estimates of how much is the impact of climate change, but there was a study that done some time ago that between the years 2030 and 2050, climate change is expected to cause approximately 250 additional deaths globally, including 30,000 in the region. And you know, we know that our region is not a major contributor to climate change, but unfortunately we bear the consequences. And actually the Eastern Mediterranean region is next to Africa of being affected with the consequences of climate change. Malnutrition, malaria, diarrhea, and stress are some examples of these impacts. And the cost of this, if we turn it into money, is huge. You know, the world would be using from $2 to $4 billion just the impact on health and the health sector. As I said, the WHO did an estimate of burden of environmental risk, including climate change. Globally, 13 million deaths are caused annually because of different environmental risk factors, including 1 million in the region. And in the pie chart in front of you, we see that 50% of those deaths are caused by air pollution. And we know about the strong relation between air pollution and climate change. Air pollution is affecting or causing climate change, and climate change, unfortunately, in turn, is increasing the levels of air pollution. Exposure to toxic chemicals is responsible for 11% of the deaths. Occupational risks, if unsafe food, unsafe water. And if you try to analyze all these risk factors, all are exacerbated and affected by climate change. So that will give you how complex is the relation between climate change and health. These are the 22 countries of the region, and with the rate of death attributed to environmental risk, including climate change. As you see, unfortunately, the poor countries of the region, the least equipped, to cope up with risks, are more affected. A country like Somalia or Afghanistan, the rate of death is very huge, and there is a real need for strengthening the capacities of the health sector in those countries. This is an example about the percentage of deaths caused by air pollution for the past 20 years. It's very clear that the toll is increasing, not necessarily all because of climate change, but we know that the impact of air pollution in the region is very serious and is increasing. The same thing if you look for the percentage of death caused by non-optimal temperatures, whether cold or warm. In the region, it's warm actually. And as you see, it is increasing, and part of that increase is due to climate change. You know better than me, there are several models, to forecast what are the impacts of climate change in the region. And the worst case scenario, these are the changes that are expected in the 22 countries of the region, not necessarily with the same level, but in generally speaking, temperature will be rising. With more temperature extremes, and I say it sadly that there was a recent report that parts of the region will not be livable in 2050 because of the extreme weather, extreme heat. There will be drop in total precipitation, and we know how much this is linked to the already water scarce region. Possibly we are the most water scarce part of the world, and climate change is adding to this. We know that there will be increase in drought frequency and intensity, and at the same time, although the overall amount of precipitation will be less, but there will be more extreme rainfall events, and we've seen this in Pakistan, we've seen this in Oman, in Jordan, and other parts of the region. Increase in frequency of and duration of dust storms. This is, to a certain extent, is unique to our region. Our region, unfortunately, is called the desert belt region, where dust is affecting the 22 countries of the region, increasing the levels of air pollution and causing a lot of damages to the agriculture and transport. Also, we are expecting that the sea level rise will affect several parts of the region, and there was a very famous report published a couple of years ago telling that 10 major cities of the world, including Alexandria, for instance, Egypt, will be drawn unless action is being taken, and we know how those consequences will affect the health of the people. Accordingly, for the past 20 years, WHO was addressing different aspects of climate change and health, but for the first time, where we have climate change and health officially on the agenda of the UNFPA, I presume the climate change treaty, the UN climate change treaty, and the official negotiations that are going between the different parts of the world on to reduce the greenhouse gas emissions. For the first time, the official announcing the health program was done in Glasgow in 2 years ago, where the health program was announced, and the health program included 4 or 5 commitments, including one commitment that countries of the world were requested to upgrade their health systems to be climate resilient. What does this mean? This means that there will be climate change and health vulnerability and adaptation assessment, which is an assessment of what are the health outcomes that will be affected by climate change and what are the measures to bridge those gaps in a form called the HNAP. And the second commitment was to lower the carbon footprint and increase the resilience of the health system by doing a baseline assessment of the greenhouse gas emissions. We know it in different parts of the world that 4 to 5% of the emissions, the greenhouse gas emissions, are emissioned by the health sector. And several countries of the world committed to make this zero at some time, in the coming years. And also, the countries were requested to prepare an action plan and roadmap on how to lower the carbon footprint. And WHO, for this reason, issued different frameworks to help the ministries of health of the world in building their climate resilience health systems as well as healthcare facilities. When the global climate change and health program was launched in Glasgow, the countries of the world were requested to announce their commitments, and 62 countries actually announced their commitment in Glasgow, including, very proudly I say it, including 12 from our region, namely Bahrain, Egypt, Iran, Jordan, Oman, Morocco, Palestine, Pakistan, Tunisia, United Arab Emirates, Yemen, and recently Kuwait. All the 12 countries committed to upgrade their health system to be a climate resilient one. Some of those countries were committed to upgrade their system to lower the carbon footprint of the health system, and through 3 of them actually were very ambitious in setting a year that by 2050 the emissions coming, the health sector will be carbon neutral or carbon free, and WHO along with other partners started moving resources and support to help those countries in meeting these commitments. Just to give you an idea about what the health achievements that we did actually in the previous COP in Sharm el-Sheikh last year, WHO helped the countries in involving the health sector in the official negotiations. The official negotiations happens between the governments, the treaty, the partners, or what they call them officially the parties, and the UN and other partners. But usually the focal point for the negotiation are the ministries of environment and sometimes the ministry of energy. Well, we try to help in adding the health component to the negotiation, that at the government level, whenever they discuss the future of climate change, to keep an eye on health, the impact on health, and how to lower the health impact. Also, we had a very high level side event on what we call the ATTACH, the Alliance on Transformative Action on Climate Change and Health. Also, we offered a lot of training, to help the negotiation, and we supported a pavilion similar to the other agencies, and in that pavilion, a lot of hot issues on health were discussed. Also, we supported the government of Egypt, the president of the COP27, in different initiatives related to water, women health, nutrition, youth, cities, and also participated in with the different sectors in order to make sure that health is addressed. In the COP negotiations, we prepared briefs, for the members of the negotiating teams on loss and damage, adaptation, mitigation, finance, agriculture, and other related sectors. To be very honest with you, from the region, six ministries of health participated in the COP27, but unfortunately they were not able to join the official negotiation. We hope that this will improve in the coming COP in Dubai. We train the professionals to be good negotiators, and the training is available online for those who are interested in better understanding the climate change and health, the history of the UN climate negotiations, the Paris Agreement, from Paris to Sharm el-Sheikh, and from Sharm el-Sheikh to Dubai. Then the negotiations, the health negotiations, and the green recovery. We have online modules that are available for those who are interested. As I said, the attach was launched in Sharm el-Sheikh with the co-leadership from the UK and Egypt, and hopefully the United Arab Emirates will be also co-leading the alliance, which will be geared actually to help the 62 countries in meeting their commitments technically as well as financially. The WHO pavilion, I don't know for those who attended the COP, it was a very busy pavilion. 60 events were organized with participations of hundreds of experts from different parts of the world. We also participated in both the green and the blue zone. We also supported the Ministry of Health of Egypt and the government of Egypt in the Global Youth Forum. For Emirates, we are more ambitious. There is a tentative program that is being discussed with the UAE presidency, the COP presidency, to address five main issues. And again, don't quote me because this is tentative and under negotiation. We are planning to have a health day. This is the first time where health will be addressed in one whole day. Then we will help the partners as well as the countries in order to add health to the global stocktake that is being going, and which will be the main theme of the COP28 in Emirates. Also, there will be a detailed session for the attached, the transformative action on climate and health, and we'll add energy. And there was an initiative that we did is to electrify the health sector in poor countries using, green resources. Also, we will, in collaboration with countries and partners, help addressing health in the global goal for adaptation. And again, to put a face to the human face to the climate loss and damage, which was just endorsed, in Sharm el-Sheikh. Thanks for listening. I hope the presentation was not long and boring. Back to you.
Thank you so much, Mr. Mazen, for sharing. I think there's a lot of takeaways and valuable insights that were shared in the presentation. It's striking to see the number of deaths that have been increasing for the past 20 years, but at the same time, it's also great to see that the countries in the region are also taking transformative actions. There has been measures that are being taken, commitments to achieve net zero targets by 2050, which is also one of the things that the UAE has also said, and also to see the substantive engagement of the World Health Organization at the COP20, at COPs in general, and also looking at the ambitious plans for COP28. I do see some engagement in the chat, and I also want to remind the audience that the presentation will be part of the recording of the session, so you can find all the information from the presentation available on our YouTube channel afterwards. If you have any questions that you would like to address to Mr. Mazen, now is the time. Please share on our chat, and we will be happy to address. Before moving to, we will return back to the discussion towards the end of the session, and now we can move on to our next guest speaker for commentaries. And I'd like to introduce Ms. Mollie from the United Nations Population Fund to tell us more about the sexual and reproductive health implications due to climate change and the variations how age and gender can also have an impact on how we can have the impacts of climate on our health. So Mollie, over to you.
Great. Good afternoon. Thank you so much, Sarah, and thanks to the UN in the UAE for including UNFPA on this panel. I think for those of you who aren't familiar with UNFPA, we are the Sexual and Reproductive Health Agency, and we are focused on 3 transformative results. So just to let you know where our orientation comes from, we're focused on preventing maternal mortality, reducing unmet need for family planning, and eliminating or reducing gender-based violence. And that includes harmful traditional practices like child marriage, as well as female genital mutilation. So when I come today to this panel, I want to focus a little bit about our mandate, as you said, Sarah, in terms of what is the link between climate change and sexual and reproductive health, as well as gender-based violence. So I think Mazen's presentation was excellent, and it really set up some of the key framing, let's say, of the issue. So it's great.
Mollie, I'm so sorry to interrupt, but we cannot see you. So perhaps if you can turn on your camera, please.
Okay,
so the
it's
audience can
on
also
from my
get to
side, but let me
Thank you.
let me try. Can you see me now? It's showing. I see myself. You're not able to see me though. I'm clicking it on and off, but you still don't see me.
Still no video, but no problem.
Okay, yeah, I'll continue. Just I know for the time. And sorry, I'm not sure what the glitch is. As I was saying, from our perspective, we are really pleased to know that and to see and to have been involved in increased focus on health in the COP conferences from 26 and now preparing for 28. So looking at our mandate and thinking about the impact of climate change, I go back to Mazen's slide where he showed some of the vulnerability factors and understanding that climate change does not affect everyone in the same ways. And so he mentioned that some of the factors are demographic, biological, and socioeconomic. And that's a really important point. And UNFPA in recent years has been looking to build knowledge as well as evidence in terms of the direct and indirect impacts of sexual and reproductive health, of climate change on sexual and reproductive health and gender-based violence. Of course, this is really important to understand because our mandate and the issues we're working on are closely linked to the attainment of the SDGs. And as has been mentioned, climate change is really, putting a spin on everything. So I want to go through a few of the direct links and a few of the indirect links, and then I'll just make a few recommendations. So in terms of direct links between climate change and sexual and reproductive health, from a few studies around the world, we've seen that there's actually a direct link between a heat wave, so a 1-degree rise in the temperature, resulting in a 5% increase in preterm births and a 6% increase in stillbirths. From Bangladesh, we have evidence that rising sea levels and the changes in the salinity of the water also negatively impact pregnancy outcomes in terms of increasing hypertension and blood pressure of pregnant women. And if we think about some of the indirect linkages, we know, for example, from Mozambique, where there is flooding, there's a demonstrated decrease in access to sexual and reproductive health services, which mean that women, girls, and families are having challenges accessing family planning. And also pregnant women are having trouble accessing skilled birth attendants and the pre and postnatal care that they need. There's also been a global review of 41 extreme events that are climate related, let's say weather events and gender-based violence. And what that shows is that in most of those cases, there was a demonstrated increase in gender-based violence either during or after the extreme event. And why is that? Again, this is sort of where the indirect link, we think about a natural disaster, a flood or a heat wave, obviously changing the economic stability or creating instability. I think we are all aware about changes in terms of food security leading to greater food insecurity, mental stress that's associated with these changes, and disrupted infrastructure. All of these factors will exacerbate gender inequality. So just to give one example, if we think about a drought in a country, we can imagine that for those who might depend on subsistence farming, that would lead to a loss of livelihoods. A coping mechanism for that family may be early marriage of their daughter. An early marriage would then lead to an early pregnancy. And we know that early marriage and pregnancy have serious effects on young women and their bodies. Girls who become pregnant before 15 are more susceptible to placental tears, obstruction at the time of delivery, and maternal mortality. We can also imagine, and it's actually, we have the evidence that early marriages often lead as well to gender-based violence. So again, this is just showing the indirect linkages between climate change, gender-based violence, and maternal health outcomes. So we have direct and indirect impacts of climate change. Now, what can we do? So again, I will reinforce some of the recommendations or the points in the area in which WHO is moving. One, we need to make sure that climate adaptation strategies include a focus on strengthening health services. And of course, we need to make sure that sexual and reproductive health services and services for women, adolescent girls, and young people are included. They're unfortunately often overlooked. We need to make sure that health is in the nationally determined contributions, and again, ensuring that SRH is part of that. And we also need to make sure that we're positioning health, education, and gender in climate change plans. Last, I think we need to make sure that we're not looking too narrowly at climate change. We know that in countries, and all of us who are experiencing climate change around the world, that there are other shocks that are happening at the same time. There are earthquakes, there are conflicts. And so this is really, the point needs to be that we need to make sure that national health plans are building resilience at all levels, at the community level, as well as at the health system level. And that increasingly countries are prepared to provide services across, continuity of services or across the disruptions, be they related to climate change, conflict, or any other shocks that may occur. So I will stop there. Thank you so much for your time, and apologies again for the video. Over.
Thank you so much, Mollie. I think this was very insightful to see that climate change, the indirect implications of climate change, as well as the direct implications on health, and that also leads to other socioeconomic issues, displacements, and a lot of demographic changes as well that need to be taken into account. And perhaps some of the key takeaways that as you've outlined is that climate adaptation measures must include health as one of the pillars and center, and they also need to be inclusive of the needs of women and young girls specifically, which is why it's very important to, when we talk about climate, it's now not only an environmental crisis, but we are looking at the intersection between all these different sectors and issues, and which is why we have to look also on health, education, and gender from that lens when we look into the climate change plans. So thank you for joining us today as well and for sharing these insights. So now we can move to Mr. Hossein, who will also be telling us a bit more about the work of the UN Emergency Management Group. And Hossein, if you can tell us a bit more about the roles and duties of this group, and how are you addressing the climate crisis and the impact on health as well from your own area. Thank you.
Thank you so much, Sarah and colleagues, for having us. I just want to clarify one point, that the Environment Management Group stands for the EMG stands for Environment Management Group and not Environment Emergency Group. So just to clarify our definition. And I am heading a secretariat of this group, which is based in Geneva, and it is composed of 52 UN organizations. We promote collaboration amongst these 52 sectors on environmental matters, so that more integrated approaches are defined to tackle global environmental issues such as climate change through collaboration and integrated thinking. So that's the DNA of our group, and we have dealt with so many environmental issues with these sectors. What I wanted to bring to this exchange and brainstorming is some of our findings on the importance of the nexus of health and climate amongst the many other nexuses that can help our thinking in terms of implementation of the Sustainable Development Goals. We have worked in the United Nations amongst these 50 UN entities around many nexus topics in order to show the importance of environmental sustainability in achieving Sustainable Development Goals. We have dealt with the issues relating to environment and labor, trade, security, infrastructure, and so on. But when we look at the health and many environmental challenges, we have found that this is the most relevant and most complex nexus, where we have found it the most important common denominator for collaboration amongst various sectors. So I would like just to highlight how important it is to invest more thinking and brainstorming on this nexus of health and environmental issues such as climate, but also biodiversity, chemicals and wastes, and pollution, and try to really through that thinking bring more attention, awareness, and involvement of several sectors to decision making and also collaboration to address environmental crisis of our world. So that's the first sort of opening point to highlight the importance of this nexus. The second point I want to bring here is very specific to a topic which has affected the Middle East region and also the North Africa the most, and that is the phenomena of the sand and dust storm. Many of you might already be aware of this challenge and its relationship with climate change, but also with the health. I find it super important that as we prepare for a climate COP, as we prepare for the desertification COP next year in Saudi Arabia, we benefit from this opportunity of COP of the climate change in UAE to promote awareness, raise awareness about the delicacy of this nexus and its importance for our region from a variety of perspectives. The sand and dust storms are considered as both the results, but also the causes of climate change, and consequently have severe impacts also on human health and also on the ecosystem's health. So it is a phenomena that has been increasing over the last few decades, and it is more and more showing its impact to both our weather systems, to our environment being land, soil, water, biodiversity, to the health sector in terms of communicable and non-communicable diseases, to the mental health of the people, and to the respiratory issues. And our colleagues from WHO, Mazen, has alluded on those aspects in his presentation. It has impacts on agriculture, transportation, infrastructure, and on our security and dialogues in the region. So it has really a broad range of issues. And I think, again, the health nexus here can come to the help of both climate change and also addressing sand and dust storm, especially in the most affected areas. What I would like to propose as food for thought, and I'm happy also to engage into more discussion around this, is what can we do to bring the importance of this nexus to the attention of both our people, but also to our policymakers. And this could include the provision of raising more awareness about this and its impact to our health and also to the other sectors as well. I think there is a lot of work that WHO has done in terms of showing the level of impact of sand and dust storm to the health of the people, especially in the most marginalized and vulnerable sectors and parts of countries in our region. So that's very important to raise that awareness to policymakers. There is a lot of work to be done in terms of expanding our research on this phenomena, because it is a seasonal phenomena, and there is more research both on the scientific causes, but also on the social aspects of this phenomena, in order to make more, people more alerted and also familiar as how to deal with this in the case of occurrence. We need to have more integrated work on the scientific research around this topic, and also more integrated decision making to make the sort of science close to the policy. There has been a lot of work on the sand and dust storm by specific sectors such as meteorology or environment or health, but unfortunately these areas of works have not been interconnected. Therefore, we do not have a very comprehensive overview of how these are impacting each other, these various sectors, and how can we avoid, predict, and better prevent and also forecast in the case of occurrence. So my last word is simply a plea to all of us to raise more awareness around this topic in the next few months, approaching to the UAE COP, but also towards the COP of the desertification in Saudi Arabia. And hopefully that will result in more collaboration in our region, which are affected by, certain political discomfort and lack of dialogue, and hopefully through the lens of health, which is the common cause and concern for all of us, the health of the human being and also the health of the ecosystems, we can bring more dialogue and collaboration around this Nexus area. I'm happy to expand on that and answer to any questions, but over from my side for now.
Thank you so much, Hossein, for being with us today and for sharing. And a lot of valuable insights have been mentioned, including the need for more data and research to bridge that gap with the policymakers and to support as well in the negotiation process and in policy making. And I think also one of the things that you've mentioned is very important, that health is a universal issue, that this is a universal priority for all of us. And when we are talking about the climate crisis, we have to come together and work together and collaborate, specifically in the region. And as we saw in the presentation, being one of the most regions affected by climate change, we have to join hands as the United Nations between different entities and as governments and as the civil society, academia, and all members of the private sector as well, to come together and find solutions, because we do not have enough time. And speaking of that, now we move to our next guest speaker, Deena Mariyam from the Health Working Group at YOUNGO. YOUNGO is the international network of youth and organizations, and it's a youth climate movement under the constituency of the United Nations Framework Convention on Climate Change. And we've seen lately that youth are taking a more central role in the climate discussions. And in the last COP27, we also witnessed the first ever Children and Youth Pavilion and also the first Youth Climate Champion. And these are really important milestones to acknowledge that young people are now having a more substantive role in speaking up and in taking matters into their hands. So Deena, over to you, if you can tell us more about what YOUNGO's plans are and how the Health Working Group addresses the health aspect in climate change, and your preparations as well ahead of COP28.
So hello everyone. I know it's a sleepy afternoon timings for a lot of us in this region, but I would like to highlight that whatever the time is, it's important to have the climate change discussion, and more importantly, the climate change and health discussion. So I would just like to give a small introduction about YOUNGO. So as Sarah already mentioned, YOUNGO is the official youth constituency under the UNFCCC, and I am part of the health working group under YOUNGO. YOUNGO has many working groups, and health is one of the working groups under the umbrella of working groups we have. And to want to know if you want to join YOUNGO or how to participate, I will be sharing the links after I speak. So how is the health working group working towards COP28, and what are our motivations and enthusiasms? Like Sarah already mentioned, the COP27 was the first ever COP to have a youth and children pavilion and a COP27 youth champion, and youth are coming forward to do all that they can. They are also being part of negotiations. They are part of being member state delegations. They are part of civil society. They are part of academia. So everywhere youth are present, and we are also present as a separate entity within the discussions. So the health working group has been doing a lot of work. We also did some work at the COP27. At COP27, we had around 5 side events. One was at the WHO Pavilion around climate change and climate change being right to health. We had something around the nexus of antimicrobial resistance and climate change. And the one we had in the youth pavilion having the role of youth in health. Apart from that, we have our own working group structures. We have been working on a policy document and a toolkit. A policy document mostly demanding youth demands in health, and the toolkit having a more of a reading experience and having a more of introductory experience to advocates on how they can advocate on ground, and sharing the best practices of youth in the health sector. One of those which one of the members of the working group had come across a research on how the increased climate change increases the salinity of water, and that has affected the menstrual cycle in girls. And then we had research on why climate change and health education is important in the medical curriculum. So there's a lot of work going on, and I think most of the speakers covered most of the things. That is, health is a complex issue. There is increasing heat waves, highlighting taking reference from the IPCC reports, and UAE as the next COP28 host. I think this integration of youth and health is coming together beautifully, because at one end there are exciting draft agendas. We might have a global health day and all of that from the WHO side with the UAE government's help. And on the other side, we also have a youth climate champion and a big team who is supporting youth participation. So I think that kind of nexus or that kind of interaction would be something which will beautifully play out at the COP28 this year. Apart from that, my final message would be there is increasing heat waves. There is going to be increasing burden on the health care system, and there is going to be increasing amount of floods, droughts, malnutrition. There is going to be a doomsday type of crisis coming soon on our way, and we are going to lose cities as well, like Mr. Mazen had mentioned in his presentation. So some of the solutions which the youth have come up for this problem is financing. Financing is the key solution for many of the issues. So the developed countries need to finance the developing countries, especially with the health mitigation strategies. Under mitigation, health should be priorities for many countries. And then we need to have open access research. Research contributes to the growth and making our advocacy and making our position stronger. And I think that should be important. We need training of professionals to deal with the upcoming climate crisis. I think a lot of health professionals are unaware of the climate crisis actually becoming one of the top priorities in the coming years. And so there needs to be a training given to medical professionals in the coming years. So these are our recommendations. And I hope with public sector, private sector, academia, civil society, youth, children, everyone comes together and highlights these issues, and we can counteract the complex health and climate and health agenda. Thank you for now.
Thank you so much, Deena, for joining us today and for all the work that you are doing and the efforts in bringing in the young people into the discussion. And as you mentioned, of course, when we look at the trainings, it's also important that we have the knowledge and the information. So health experts also getting the right training to be equipped and to have the knowledge and raising awareness, which is also something that Hossein has mentioned and Mr. Mazen has addressed in his presentation as well, and Mollie as well touched upon. We did have, I just wanted to let the audience know that we do have some links and references shared in the chat, and one of them includes the link to the online courses provided by the World Health Organization on climate health and negotiations. So you can find the information through the link and enroll and have a self-paced education training courses on these topics. And one of the questions that was also addressed in the chat was addressed to Mr. Mazen on mentioning the engaging young people in on the road to COP28 and WHO's plans. And there has been mention on the Youth Forum and Health on Climate Change that was hosted last year at COP27. So Mr. Mazen, if there's anything else that you would like to, if there's anything you'd like to add to that, or any perhaps expectations for the audience to know on when we can receive more information about the forum, because I'm certain that many people in the audience would be very interested to know.
Yeah, thanks a lot, Sarah. I think the youth will continue to receive the utmost attention of WHO. We already started in Sharm el-Sheikh. We will build on what we achieved in Sharm el-Sheikh and further strengthen it in Dubai. As I said, still the negotiations are ongoing with the UAE presidency of the COP, but most probably it will be an integral part of the health day, you know, health, climate change, and youth. That is something that we keep it on the agenda. And thanks for raising the issue of the need for training. In fact, WHO, you know, if you know, has an academy that started offering official training for different target audience. Climate change and health, I'm glad to share with you, will be the first training course on environmental health that will be offered by the academy. And hopefully this will be repeated on a frequent basis. But please, if you feel you need such a training, don't hesitate to write to us, you know, and I'm sure we will find an opportunity of organizing an online or an even face-to-face training. Back to you.
Thank you so much, Mr. Mazen. I can also see that our colleague Saleh has shared his email address, and so you could feel free to reach out to them for more information. And if you would like to know more, there has been also some other reference documents shared by Mollie on the sexual health and reproductive and climate change intersections, some useful reading materials. And we also have from our colleague from Marcus on FAO side that they also are addressing the sandstorms and the importance of this topic. So Deena has also shared the links to YOUNGO, and we will also make sure that we circulate these across. So if there are no further questions from the audience side, perhaps we can move on to closing remarks, and maybe we can have final words from each of our guest speakers for today. If you can leave us with some food for thought. We know that health and climate now are it's a crisis, and we are at a very critical stage. But hopefully we can leave the audience on a hopeful note that there is some time for us to create change and to have a better outcome, hopefully, if we take the right measures. So I'll move on to each of the speakers to have a quick final remarks before we close today's session. Thank you. Over to you. We can start by Mr. Mazen, and with the same flow of the speakers for the session.
Thanks a lot. I think the message is we need to be ready. Things are changing. We are no longer discussing whether climate change is happening or not. We started feeling the impacts, and we need to be ready. Probably the young people has more role to do in being prepared and contributing actually to the change. Back to you.
Thanks so much. And from my side, I think, yeah, it's excellent to see the young voices and the healthy pressure, I think, that that they're putting on us. I think my key point is really just as we move forward, and again, thanks to the momentum from WHO and others who've really ensured that health is present and visible in the COPs, that we think again about the diversified impact, and then we make sure that we are adequately looking at diversified data and the impact on women, girls, young people, old people moving forward. Thank you so much.
Shall I?
Yes, Hossein, over to you, please.
Great. So I would like to acknowledge that today is a very important day. It's an International Women's Day. Congratulations to all of the ladies in this brainstorming in this webinar, first and foremost. But it is also, more importantly, a very important notification to all of us that we have to look at this nexus of health and climate, and as I said, and I narrowed it down to the sand and dust storm, from a point of view of the role that women can play to raise more awareness, also to show how much impact has been put on the women, especially and the children, especially in mostly impacted areas, the most remote border areas in our region, in our countries. And let us hope that this COP27 will bring a new momentum in highlighting the role of women in addressing the climate change and health from a point of view of sand and dust. And I'm more than ever motivated to contribute to the future thinking and discussion on this, to also benefit from the desertification COP in Saudi Arabia, really to bring more knowledge and awareness around this topic and its impact to the human health and also to the ecosystem's health as well. Thank you.
Thank you so much, Hossein, and happy International Women's Day as well to all the women here. Thank you for joining us today. And Deena, over to you, and perhaps if we can address one quick question that we had from the audience on the trainings, available trainings and research that areas that YOUNGO Health Working Group is supporting in. Thanks.
Thank you so much. Yeah, so the available research and training, right now we have just brainstormed a few ideas. That is One Health, AMR, and Climate Change and Health, and there are a couple of local youth and advocates who are researching, and we do support them by connecting with people in the UN and UNICEF or UNFPA. So any other specific research we come across, we will definitely share. And we have we're just in the brainstorming session phase right now. And the other two questions I would like to have as closing remarks is Someone had mentioned about obviously the Global Health Forum and asking how they could contribute. I think that was the past contribution. And if you do want, and several of our working group members had contributed last year as speakers at the session as well. So if you do want to get involved, you can join YOUNGO, and we can always reach out to WHO to get the representation and the engagement. And last, I would like to say is youth. Obviously, meaningful youth representation is important, and the healthy pressure we give, we'll continue to give, just reiterating Mollie. But the other factor is youth need to also work on ground. It's just not about globally making noise, but you also need to make changes locally. So increase public awareness in your cities, in your communities, do research in your cities, in your communities, and like work with the government, local government and private sector in your communities, and that will get translated globally as well. So youth have a very important role in that, and don't forget that role. Thank you.
Absolutely, thank you so much. I think this is no better way to close than on that note. We really appreciate all the speakers for joining us today, from Mr. Mazen to Mollie to Hossein to Deena. We really hope that you were inspired by the discussion today and ready to bring back the learnings to apply them within your organizations and within your communities. Thank you once again for joining us today, and we hope to see you again soon. Next week, same time, different topic. And feel free to also follow us on social media at UN_UAE to keep informed on all the previous and the future webinar sessions that we are engaging on the road to COP28. Thank you once again, and a special thanks to all of our guest speakers for dedicating the time and sharing their knowledge and expertise with us here today. Thank you. Bye-bye. Thank you.
Bye.